and welcome to Care Partner Q&A Mondays at the Inspired Memory Care Training, Education, and Resource Center at the 80th Street Residence. Hi, I'm Nettie Harper, and I'm with
Gilligan.
And we are not coming to you live this week from the Upper East Side of Manhattan. We are actually coming to you live from our own homes. We will be having a guest speaker that will actually be joining us from the 80th Street Residence. She'll be joining us just a bit later. Our organization, Inspired Memory Care, collaborates with a vibrant community of individuals living with Alzheimer's disease and related dementias and their partners in care. We have both worked with the individuals living with dementia in our personal and professional lives for over 20 years and have found our passion in the challenge, growth, and hope that can spring from the bonds we forge and maintain during the process of caring through cognitive change. It's been our experience that great care partners persevere through the struggles by having a team of like-minded individuals to be creative with and to lean on. We also know from experience that key education about cognitive change comes not only from research and experts, but from the people who are living with it.
So every week we meet at the 80th Street Residence with our team of professional and family care partners and with the folks who live there for focus groups, pilot testing, and feedback on the research that we do. They keep us grounded and let us know when we're on the right track and also when we're on the wrong track. It's our pleasure to present today's segment of Care Partner Q&A Mondays as an initiative of the Training, Education, and Resource Center. Please, if you have a topic that you're interested in us discussing, feel free to type it in the comments section or feel free to email us at info@inspiredmemorycare.com. Today's topic of conversation is a guide to transitions, home care, assisted living, and beyond, and we'll be joined in just a few moments by Lindsay Harbison, the Assistant Executive Director at the 80th Street Residence, to give us a little bit of inside information on the process of transitions.
So is there a right time for in-home or residential support? Well, there are some key considerations for adding support. So the first one is we need to look at socialization. All people benefit from peer-to-peer interaction and the stimulation of seeing others, regardless of age. And I think we can all agree with that, considering we're all living through this pandemic, right? We're missing some of that face-to-face interaction with others. We're social creatures. Even those of us who are loners, we need to see others. As an individual progresses through cognitive change, socialization becomes even more important as it's one of the best protections against rapid decline. We often hear that my loved one just sits in front of the TV all day. I think that's the biggest phrase we hear. Wouldn't you agree, Kelly?
Yeah, it is.
Yeah. So creating opportunities for stimulation through participation in a community-based program, and yes, I realize that there aren't too many of them out there right now. However, many of them have actually transitioned online in this time of COVID-19. And if you are looking to see some of those online opportunities, Kelly and I did a past episode, and you can certainly, comment in the box here below and let us know if you're interested in that, and we can email that to you so that you can find more information on some of those online virtual opportunities. Because certainly, opportunities for socialization can still happen remotely as well. There's also there's support through home-based support from a companion may be helpful. It's important that the individual visiting has knowledge of communication strategies specific to an individual living with dementia, or visits may prompt agitation. So with that said, Kelly and I also did a past episode, two that you actually might find interesting. One was communicating creatively with your loved one living with dementia. This might be a nice one for you to actually watch. And also if you have somebody coming in from home care, if you can have them watch, it really gives a lot of techniques on how to communicate creatively with your loved one. The other one that we did, I don't know if you remember this one, Kelly, it was actually one of my favorites. It was about old-fashioned engagement without technology devices, and it can be done. And I really liked it, Kelly, because so much is out there about technology now, but you know what? People can still enjoy things that don't involve technology. So I thought that was a really nice opportunity for family members to see.
Absolutely.
So,
and technology is not for everyone. So absolutely.
isn't that the truth? Isn't that? Okay. All right. The other thing we want to, just be mindful of, if logistics are making it too difficult to combat isolation at home, it may be time to consider a move to a residential setting. In a residence, even if a loved one is not a joiner of activities, meal times, one-to-one visits from the recreation team, and visits from the team provide opportunities to see and interact with others. So that's just one consideration you want to think about, socialization. A second consideration would be safety. When an individual progresses in his or her disorientation to time and place, he or she may be at risk for becoming lost, forgetting to eat or take medications, or struggling with disrupted sleep cycles. So opportunities for support with maintaining a daily rhythm and orientation to the environment, whether in the form of home care or a shift to a residential setting, may actually be in order. Another important consideration, and one that's often forgotten, is the well-being of you, the care partner. Many times, extraordinarily dedicated care partners such as you might be struggling through these changes with ill effects to your own health and your own relationships. This can be due to fear of disrupting the status quo, difficulty relinquishing your roles, and often you might be experiencing some guilt. But the letting go and acceptance of help, while it may take some time for adjustment, can often improve the quality of your interactions between you with your loved one, with your family, with your friends. It also might allow you more time with your husband or your wife. It might allow you time to be a parent again. It might allow you time to be a child again. So please consider that in your kind of onlook on whether it is time to have help in the home or whether it's time for residential support. You've got to look at your own well-being. Now, again, there's no one right answer or one right time for a person to intervene. Individuals have different resources available in the form of members of the care team, finances, community, neighborhood support, and physical spaces. They also have unique life histories and relationships. So again, we just want to stress there's no one right answer, but we do want you to consider socialization, safety, and certainly, and really, I don't want to say the most important, but really it's up there, is the well-being of you as the care partner. Kelly?
Absolutely. So, as Nettie mentioned, it can be really overwhelming for a family to introduce home care, especially when a person who's living with dementia lacks insight into why he or she might need assistance. We hear often, I don't need help. Maybe you need help, but I don't need help. That's a common, right? It's a common refrain that we hear. There are some factors that can make for an easier transition. We're going to talk about how to introduce change in a future slide because that process in itself can set you up for success or failure. But in general, here are a couple of tips for identifying an agency that will have the expertise to partner with you more smoothly. And obviously, that's really important to the process. So number one, you want to ask about the appropriateness of a companion versus an aide. Nettie mentioned a companion a little bit earlier. A companion is traditionally trained to provide cueing, supervision, and engagement rather than hands-on assistance with care tasks. So obviously that's a pretty big difference. If your loved one is not yet ready for physical assistance with things like dressing, using the restroom, or showering, you may want to consider exploring the option of a companion with an agency. Sometimes when a person says they don't need help, this is more along the lines of what they need. And introducing the physical assistance too soon can cause a fight or flight response, and it can lead to trauma surrounding home support, which is definitely not what we want in this scenario. Because once you have that bad interaction, making the change and moving the process forward, you're constantly kind of climbing back uphill rather than being on an even keel. Ask about the type of training for dementia care that's provided to team members. All agencies provide some level of education about memory support to their team members. Most states actually mandate that training, but some agencies go above and beyond state mandated hours. And an agency that's providing training on things like conversation and activity techniques that promote the participation of people living with cognitive change likely understand that engagement in meaningful experiences is very important. When you have your loved one or friend present with a companion or an aide during the day, it's not going to boil down just to the physical care that they're providing or the supervision that they're providing. If you want him or her to be accepting of that person in the environment, you really want to ensure that they're able to develop and forge more of an emotional bond. And that will also give you peace of mind. Take note of the language that's used in your discussion of individuals living with dementia. If the agency representative is using person-first language, such as a person living with dementia or simply your mom or dad or a loved one or friend's name, that's a good sign. Does he or she mention what happens if the home attendant is not a good fit personality-wise? You really want to make sure that there's flexibility and that the agency is willing to collaborate with you. If your loved one has any specific clinical needs, for instance, some people may need support with a catheter or they might need help changing an ostomy bag, you want to know, when will the home attendant have had training on this skill? Sometimes there's a little bit of a window of flexibility on things like that. You really want to make sure that the person is prepared going in so that there aren't any situations that arise, and also that they've had recent experience or a refresher on it recently. Sometimes when you don't use a skill repeatedly, you can kind of have a lapse in that, in your awareness of the skill. And then, what is the frequency of supervision visits to the home? Some agencies will actually provide ongoing support by a nurse or a social worker or a case manager, and many will send the nurse or the social worker or case manager out at specific intervals. So you want to know, how frequently are they going out, and what happens if there's a change in my loved one's status or an event that's a concern. Also, what support is available telephonically? How do I go about reaching somebody overnight? And are there additional support services included maybe that I haven't thought to ask about? For instance, some of the agencies that Nettie and I have worked with actually provide a therapeutic recreation specialist that does training for the aides, or that will go out and do some consultation. So that's, you want to really be aware of what services are available to you. And then another consideration is, what happens if your loved one or your friend runs out of money? Is the agency accepted by long-term care insurance policies? Can you keep your aid if you transition to a Medicaid payment system? Does the agency accept Medicaid payment? So all of those are considerations financially for how to partner with an agency for success in the long term. And then the last point that we really want to emphasize with you is simple honesty. The more upfront that you can be with the agency and the more information you can provide them to prepare for the partnership with your loved one, the better chance that you have for success with them. And I know, Nettie, you and I have, we certainly have some stories, and we certainly have had some experiences where we were finding out information after the fact, or where family came to us and shared information, and we were able to be really successful. Many of the folks that are in the memory care field will tell you that, we've seen a lot, and we're open-minded. We tend to be a flexible group of folks, and so honesty truly is the best policy, so that we can make sure that we're the right fit for you and your family and your friends, and you're the right fit for us. And I think the majority of agencies are pretty upfront about that, and they're pretty willing to take on a challenge and really work, as long as there's that collaboration and that teamwork.
Kelly, I think that's such an important point that, I think families are so nervous already with trying to bring, help into the home, or even like when moving them to an assisted living, that they're afraid that, their loved one's not going to be accepted. And so what happens is they try to hide little things, and those little things start to build up and they become bigger things. So the more information that they can share about their loved ones, the better prepared the home care agency can be, the better prepared the assisted living can be. And that's how we're able to best support. Now, keep in mind, you know your loved one best, so you're the one who really needs to share that information. And keep in mind this, if you feel like you have to hide the information, is that the right home care agency? Is that the right home? No, that's the answer right there. If you feel like you need to hide it, then that's the wrong place for you or the wrong home care agency.
Absolutely.
So that's just a little tip for you right there. That might be one of the biggest tips we can share with you today.
I would say so. If there's not trust or comfort, don't pull the trigger.
Don't do it, okay? Because they're supposed to be a support for you. They're not supposed to be an extra stressor. And I don't know about you, if you feel like you're already having to lie or withhold facts, you've just added another layer of stress onto you. And that's not what the supports are about. So, all right. So Kelly, will you, thank you so much. So let's just talk about assisted living, because you said that honesty, and that goes with assisted living too. We have to be as honest as we can and forthright. So what do I look for? Well, Kelly, we've always had this message. It's never too early to know your options for the future. In fact, it's better to be prepared rather than to be faced with an emergency and having to make a quick decision. And I have to tell you, Kelly, I think that that's where a lot of guilt sometimes comes from families, because they didn't have the plan C. And when you didn't have the plan C, they didn't feel like they were able to look at all their options and make a well planned out decision. So then they're like, did I make the right decision? Did I make the right decision?
100%.
So plan now. Honesty and planning. There are many different disease processes that can cause cognitive change, and they may happen at different rates. We also never know if there will be other dramatic changes. For instance, a change in their primary care partner. So we have to plan for those unexpected changes. So most care partners, they always have a plan B, but it's important to provide a plan C. For example, there is not anyone who expected COVID-19. And many care partners that were home health aides were unable to make it to their jobs. And what happened? Family care partners had to step in. And unfortunately, many of them weren't ready, so they had extra stressors. They were trying to hold down their job themselves. They had to homeschool. They didn't have a plan C. And who would have in COVID-19? But now we know we have to have a plan C. So having a plan C can actually help minimize the number of transitions you and your care partner might go through in the event of a hospitalization or a rehab stay. So when doing this, when planning for a plan C, okay? Because we're not ready for assisted living, and that's not what we're here pushing. We're not pushing home care. We're not pushing assisted living. We're giving you options. We're helping you be prepared. We're supporting you in what to look for. So, of course, finance is a key area of exploration. Some settings may accept long-term care insurance and eventually Medicaid. Others may be strictly private pay. It's important to know in advance. And then you want to know after you get the finance out of the way, because that's what's on everybody's mind, especially right now, right? We need to make sure that the finances are taken care of. And with many of these diseases, we have to prepare for a long term. So after we've gotten that out of the way, some additional key questions to ask from each candidate that you're considering for an assisted living. What level of licensure does the residence hold? Again, that is, what level of licensure does the residence hold? Because some settings are licensed to support an individual through the end of his or her life. Others may require a move in the event of a person's mobility, swallowing, or other physical ability changes. So ask the representative that you're meeting with, what would trigger a need for your loved one to move out? Many of them are going to say, oh, no worries, they can age in place. Keep pushing the envelope. We've heard that a lot, right, Kelly? But then when we push the envelope, it's like, well, if they have to have a pureed diet, well, that's not aging in place. Many people, as we know, living throughout this disease process, they may eventually have a swallowing issue, and a diet may be recommended that's puree. So then we have to move. What happens if they become a two-person assist? Can they use a Hoyer lift here? So these are things that we need to ask. So don't just take, oh, they can age in place. Push the envelope with these questions. The second one, and Kelly mentioned this when she was talking about home care. It's equally as important in assisted living. Don't take for granted that because it's memory specific, that they have had the training. So you want to ask, what memory specific training is provided? Again, it's important to take note of any emphasis on environment, communication, and engagement techniques, as well as person-first language. If the person who is touring you starts to put the disease first instead of the person, leave. I can't say it enough, because guess what? We're teaching every single person in that building that they're going to be looking at the disease first and not your loved one first. We need to make sure that your loved one is in an environment where they're looking holistically, because there is so much more to your loved one besides this disease. So again, what is the specific training that's provided? Is it a 1 hour training? Is it an 8-hour training that's one time a year? What is it, and what's going to make you feel that your loved one is safe and secure? Staffing levels. A high ratio of care team members to residents means that your loved one may receive a faster response time when he or she has a wellness need arise. Doesn't guarantee it, because no place can guarantee anything. That's another thing. If they start guaranteeing you things, you might just want to raise an eyebrow at that, because there's no guarantees in life. We learned that at a very early age, right? A high ratio and longer hours for recreation team members generally means that the organization is invested in meaningful engagement and stimulation as a form of treatment. Now, if you've been on several of our episodes here on Q&A Mondays, you know that we truly believe that meaningful engagement and stimulation is a form of treatment. So really look at what's going on with recreation. Is it personalized, or is it large groups? And would your loved one not get the personalized attention? Are you able to meet with the recreation team? Have members of the leadership team been visible on the floor, or are they always in the offices? And do they appear familiar and friendly with the staff and residents? It's not just the staff, it's not just the residents. You gotta have both, right, Kelly? For a good environment, it needs to be staff and residents.
Absolutely. The whole community has to feel good.
Yeah, absolutely. The other thing you want to look at is environment. Will your loved one have access to sunlight and fresh air? And this is another area you really want to probe around. Meaning, is it once a week? Is it that they're saying that, oh, well, they can take trips on the bus? Okay, that's fine. But how often are we doing that? Is there a patio that you can have fresh air to? Or is that patio locked? Kelly, how many times have we gone to an environment and the patio is locked?
It's not doing a whole lot of good if you can't get outside.
Yeah, that's not free access at all.
Yep.
These are key factors for mental and physical health. Is there access to food throughout the day and night? I don't know about you, but my husband, he's going to love that I'm sharing his personal life, but my husband gets up every night and he has to have access to something to drink. How many other people that's their daily, nightly routine? What is going to change if you are living with a cognitive impairment? You're not going to change. These are your daily things. It's part of your rhythm. Now, all of a sudden, you don't have access to that. It's not going to go over well. So do you have access to food and water at your convenience, or are you having to wait for refreshment time or wait for the meal times? The other thing, is the environment clean and free of fall hazards? Does it feel home-like or sterile? Now, Kelly, I have to talk about this. Every home is very different, as we know.
Yep.
Families, don't get caught up on the huge, beautiful chandeliers and the ones that look like hotels. Does your home look like that? Kelly,
if it does, congratulations. Good for you.
Congratulations. Yeah, that's not a home. And again, as Kelly said, if it does, that's wonderful. Go for that. But most of us don't live in a home like that. Home, what does home mean to your loved one? Now, Kelly and I have often said home means where I have access to my husband, and how often do I have access to my husband? Home means that I can have my Oreo cookies and when I want them, and they're not kept somewhere else from me. Home means I can watch what I want on TV. Home means I can take a walk when I want to. Home means I have access to my friends. Home means I can decorate my walls however I want. Home means that I'm surrounded by people that I truly enjoy. Home means that I can feel life around me. So what does home mean to your loved one? It's not all the shiny things that are around me. That's not home. But you have to understand your loved one. What does home mean to them? Can the person touring you speak to the reasons for specific design elements? And if you want more information on those specific design elements, please email us and we'll send you over some questions that you can ask the person touring you. We'd be happy to support you in that. And is the environment secure? Meaning, can your loved one leave unattended, or are there systems in place to prevent this? And then last, but certainly never least in this situation, is programming and vibe. Do the team members and residents seem happy and engaged with one another? I know when I was the VP of operations for my previous company, many people would say to me, you know, the reason why I came here is because I was greeted by the team members and they were so full of life. Team members that are happy, when they're happy, there are happy residents, there are happy family members. So really, when you're taking a tour, look at how the team members look. Are they embracing the tour? Are they saying hello to you? Do the team members call residents by name? Are they respectful of resident space and wishes? Also, you might want to look at the music. Is the music playing that is welcoming? Are there indications that programs are happening routinely? And is it just one program where everyone's in it together? Or are there parallel programs where there might be options for residents to attend? So these are all really important factors to watch for when looking for, again, your plan C when you're looking for an assisted living. Kelly?
So now we're super excited for this segment to be joined by Lindsay Harbison, who is the Assistant Executive Director at the 80th Street Residence. You may recall us mentioning the 80th Street Residence. It is a partner organization of ours. We work very closely with them as they host our Training, Education, and Resource Center. And so we have access to their residents, their family members, and their care partners for piloting different programs and doing committees and focus focus groups. And so we are super pleased to have Lindsay here with us. Lindsay is going to take a moment to give some insights into the touring process and into how the team at the 80th Street Residence, and often across the spectrum of assisted living, prepares for a new resident to move in and prepares for partnering with a family or a friend. The 80th Street Residence has a few things that they do uniquely, so she'll highlight those as well. And we'll talk overall just about some of the best practices for preparing for a move. So Lindsay, thank you so much for joining us today. We're really glad to have you as kind of our guest speaker.
I'm really happy to be here today with you ladies. Hopefully I say some intelligent things with you ladies and help shine a light on what moving to an assisted living can be like for people.
Absolutely. I think that they have a really great resource in you. So let's get started. Our first question for you is, Lindsay, what can people expect during a tour?
So, I think the whole goal of a tour is to really get a behind the scenes kind of look at what a community is like. You want to be able as a family member to go in, there's something to be said for actually meeting the staff in person, with actually engaging with them in sort of a live situation versus, something that's scripted. I think it's really important also. At 80th Street, we've always said the vibe that you get when you come in the building. It's a very serene, calm environment. And I think that really speaks volumes to what a community is like. I think on a tour, some people are going to be looking for different things. It's really important as a representative of the community to get a sense of what is it that's important to this particular client. Are we looking at a case that is clinically complex and we want to, meet some of the nurses, meet some of the caregivers and learn more about the therapeutic services that are offered? Or are we somebody who is living at home dealing with a loved one who has a lot of anxiety because maybe they're just not as engaged, or, especially now during the time of COVID, getting out and going to things that used to keep them busy is really pretty much impossible. The idea of a tour is to give you a behind the scenes, snapshot of what a community is. But it's also important, as the person who's giving you the information about a community, really make sure that they're answering your specific questions, because people look at communities for all different reasons.
That's so
Sure. You're right, because earlier we were talking about, looking at different areas, and one of them was environment, one of them was recreation. We were looking at safety, the clinical. So thank you for really drawing all that in, because it is important that it's not just a cookie cutter tour. You can really customize tours. So thank you for being willing to do that. It's so important, Lindsay.
Absolutely. And,
you talked about, sorry, go ahead, Lindsay.
I was just going to say, I think especially if you're dealing with a community like 80th Street, our focus is on cognitive impairment, but you've got so many different, needs within a community that it's important to make sure that you are educating your potential clients on how you're going to meet those specific needs. Because, like we said, it's not cookie cutter. There is no one-stop, shopping for assisted living. You really have to make sure you're meeting the whole person and their needs.
Absolutely. I also think it's funny you use the word vibe, Lindsay. That's exactly what Nettie and I were talking about earlier. Was every community has such a unique vibe, and you really, what's going to vibe best with you and who you are as a family or as a care partner. So
exactly. Are you looking for a place that is smaller and more of a community feeling where you can be very involved and very much part of the community? Or are you looking for a really large facility where there is just a lot of activity and you don't necessarily have to worry about things, but you don't have to be as involved? So really does depend on what you're looking for.
Absolutely. And Lindsay, just quickly, before we move on to kind of our next question, Can you just talk a little bit about how COVID-19 has changed the touring process? Because I know it's made a pretty significant impact on that process for people.
Absolutely, definitely. So COVID-19 obviously has affected all of us greatly. When it comes to tours now with COVID-19, we are a licensed resident. So everything and anything that we do is basically determined by New York State Department of Health. So from, about March 13th until current times, we're dealing with a lot of changes, and these changes happen daily, they happen weekly. Part of what we have tried to do for the touring process is we've set up a virtual tour. It's not on our website, because our feeling is we want to talk to you before we send you the virtual tour. We want to make sure that, first of all, we are a community that could potentially be appropriate for your loved one. We also want to get a sense of what you're looking for, because the truth is, if we're not going to be the right fit for you, we want to be able to share resources with you and send you to a place that may be more appropriate. So right now, in-person tours are not necessarily happening at a lot of assisted living facilities. Obviously, you want to keep your residents safe, your staff safe. Virtual tours have been wonderful. It gives you a really good snapshot. We have also been doing FaceTime calls. I can get on a FaceTime call, a Zoom call, and literally walk with you through the building. So if you see something, you can ask me a very specific question. Well, why are the plates that color? Or why do you have Amazon Alexa devices, in all your common areas? So I think it gives an extra sort of insight and opportunity to ask more specific questions, doing FaceTime or Zoom and doing it live, so to speak.
I think that answers the question absolutely perfectly. And I love that you're having the flexibility of both the pre-recorded video and then live and in person, I think, or not in person, but almost next best thing.
As good as we can get right now.
Yeah,
right?
Absolutely.
So I think, one of the things that I think is so important is bringing the team in. So I'm just curious, how does 80th Street how does the team prepare for a move-in?
Absolutely. So we have a huge team here, but one of the things that we find to be most effective is kind of when somebody's getting ready to move in, let's start with the top and then let the information filter throughout each department. So getting ready for a move, obviously we want to be sure that we are a good potential fit for somebody. If a family gets to know us and feels, I really think 80th Street's going to be the right place for my loved one, we feel the same way. It's definitely a several step process. So one of the very first things that we like to do is what's called the pre-admission assessment. This is a New York State Department of Health requirement. We have always formed our pre-admission assessment to be more social in nature. We are not going and doing mini mental exams. We don't want to go into somebody's home and start stressing them out by asking them questions. We want them to sort of participate in this conversation with us so that we can get a sense of who are they right now in this moment. Who were they before all this, before the disease started to affect them? And, also in addition to that pre-admission assessment with the resident, we do a family pre-admission meeting because that is where we're going to get a wealth of information. I mean, we're going to find out, okay, they grew up in New York City, they grew up out in Long Island, they went to this particular college or university, this is what they did for a career. We're getting all that biographical information from the family. We're also getting insight into what some of the problems are at home. Usually a move is driven by challenges and difficulties at home. So we want to find out also what is happening that is becoming more difficult at home, and how can we really sort of help them in this environment at 80th Street with those particular behaviors or care challenges. We have always felt very strongly it is a collaboration. It's 80th Street and the family. And it's so important to be open and honest. And I think that through these meetings and assessments, families really understand that it is a partnership. And, they give us a lot of information we can work with. Obviously, how it translates when somebody gets into 80th Street. Sometimes it's really, really helpful, and we already know everything that could potentially happen. 5 o'clock, we get anxious. We start to want to, look to go to work. We have a meeting. We have to go home. We know some of these behaviors that are happening at home. And then sometimes we find out new things that we weren't privy to prior to somebody coming in. But I think the more information you can have, the better it is as far as helping with the transition to a new place. And the department heads, all of us are very involved in all of these pre-admission meetings, and then they will share information with their staff. They will filter out what's appropriate for each staff member to know. Obviously, our caregivers don't necessarily need to know about certain aspects of the resident, but the nurses do, or the recreation staff needs to know that morning is a better time for them versus evening. Obviously, again, going back to COVID, we're doing a lot of these things virtually. We have been doing some pre-admission assessments in the home. That is really up to the family because our staff here is tested every week for COVID. So we know that our staff is safe. They have the proper PPE. They can go into the home and do this assessment. So if a family wants to meet somebody in person in their home, we're totally fine with that. And honestly, that gives us a more realistic picture. The person is in their familiar surroundings where they're comfortable. So
Lindsay, you gave us some really nice insight into kind of the pre-admission process and the steps that the team takes to prepare. How long approximately does it take for a person to be able to move in?
So, that really fluctuates. There are times where we have families who come to us and we're dealing with a crisis. We're in the hospital. We're, getting ready for discharge from subacute rehab. And, it's come out that we really can't go home. It's not the right environment for anybody, for that person anymore. When that happens, most of the time we are able to work with the family to get their loved one quickly admitted into 80th Street. We can do the pre-admission assessment. We could do the family meeting. We do also need a medical evaluation from the doctor, but those typically are going pretty quickly. So we can do a quick admission. Some families, though, obviously feel very strongly about planning. This is not an easy decision to make. We have to plan accordingly. We want to make sure that family is available. They want to be around to help with the transition. And when that case happens, it can be a several month time frame from the time somebody, meets me and either virtually tours or whatever it may be, and they make that decision. It could be a couple of months just to make sure that all the pieces align, because again, you want to do what's going to be best for the resident. And sometimes that means taking time and doing things slowly. So it's flexible. I typically tell families if we're at full capacity, which is 70 residents, it could take around 3 to 4 months to move in. But again, things do change as well.
It's interesting. Oh, go ahead, Nettie.
I think that was important to share, that we also need to understand, because earlier we were sharing with families that they probably have a plan A and a plan B, but people don't have a plan C. And unfortunately with COVID-19, we all needed a plan C.
Yes.
So I think what you just said is that some places and a lot of places, they're operating at full capacity. So doing your planning right now can help you. In case that plan C comes, you will be ready and you're already on that wait list.
Yes.
Because it could take 3 to 4 months.
Yep. It's very true. I think, especially in New York City, a lot of people who are kind of thinking about doing a move, some of them really got quite frightened because, you see all these things in the news about long-term care facilities. But on the other end, you also have a lot of safety in long-term care facilities. And so a lot of people made these moves because they couldn't risk having the caregivers coming in, commuting through the city, coming into their home, not knowing, how many other clients are you seeing? Am I at risk right now? So a lot of people did make moves during this time of crisis. And, I think with it being such an unknown time, I think that is going to continue. People are going to see that the benefits are certainly there for living in a community.
Lindsay, I just wanted to ask you a follow-up question kind of along those lines. You mentioned that sometimes people are transitioning from a rehab facility or there's an emergent situation. Are you equipped to handle somebody moving into you straight from a hospitalization in order to minimize transitions? That's kind of what today's
Absolutely.
topic's about.
Absolutely. So often when people are coming to us from the hospital, again, all the assessments take place that are necessary. And one of the really nice things is we actually do have physical therapy, occupational therapy, and speech therapy, cognitive therapy here, which, I mean, many of us who have been in the hospital system know if you've been there 72 hours, you usually qualify for a subacute rehab stay. So often the direct line is hospital, subacute rehab, then assisted living. We most of the time can cut out that subacute rehab step because we do offer the therapy here. So it certainly is a viable and wonderful option to have somebody come here directly from the hospital. We work with the physicians, we have nurses here 24 hours a day. And I think also just taking one extra step out of that transition process really makes a huge difference. So it's certainly an option for people as well.
Yeah, that's what I was thinking. It minimizes the transitions. It also minimizes the exposure between moving from facility to facility to facility at this time.
Yes.
Great. Thank you for sharing that information.
So, Lindsay,
Yes.
you've shared so much. I hope you don't mind. We have a few more questions. I know
Okay.
we're taking up a bit of your time. Tell us about just maybe one or two most successful transitions you've had there at 80th Street with the team.
Okay. Well, they're all successful, but I would say there's a few that really definitely stick out. It's always, an honor to us when we have residents coming from other facilities, because it usually is going to be a more challenging transition. And the reason I say that is because if somebody's coming to us from another facility, it means that they've already had an experience that obviously during the current time, it's not a successful experience, whether it's because care needs have changed or perhaps the expectations just weren't met. There's many reasons, but I think we had a resident come to us from another memory care facility. They were there for several months. They just did not do well. Lots of instances of things not working out the way they were supposed to. The family wasn't happy. The resident certainly wasn't happy. And, we did everything we could to make sure we had set up realistic expectations for the transition, for what life is like at 80th Street. And with time, it worked out very, very well. This gentleman is actually participating in activities programs. He is having meals with his spouse, which were not happening when he was at this other facility because it was too stressful. So I think that is a really good success story to show that somebody who is doing not well in a particular community can still do well in another community if it is the right fit for them. I don't think, people really think about one assisted living is the same as the other. It's not true. There's a lot of places that are very different, and that's a great success story. And we have another woman who recently came to us. Her husband passed away. There were some caregivers in the home, no children, no extended family, just some friends who were very involved. And they found that this woman was sleeping a lot more. She was getting a lot more medication than she probably should have been getting. And so we were able to work with her doctor, get her meds adjusted so she was not on so many medications, got her into 80th Street, and she's flourishing. She's participating in activities programs. Her friends are visiting her. So to go from a woman who experienced loss and was, just sleeping and not engaged and kind of withering away to a certain extent, coming here and flourishing, that's a great success story.
Yeah, and Lindsay, I actually know who you're speaking about, and she's quite an avid reader as well. Yes. And it was so lovely to see, and basically almost like come alive.
Yes.
She just came right out of her shell, and she's living life now. Yes. So it is absolutely wonderful to see. Yeah.
And Lindsay, on a transition like that, I just want to highlight, one of the things that I've seen that you maybe do a little bit differently is that there's kind of a care, almost ambassador for the first, yeah, like, can you speak a little bit more about that process and why you've implemented
Absolutely.
that process?
Absolutely. So one of the things that we do here, we assign one of our caregivers to be with a new resident one-on-one for the first 5 to 7 days, depending on how somebody's doing. We started doing this years ago. I want to say it's been at least 10 years that we've implemented this. And the reason we did it was we were finding that no matter how much work we were putting into a move-in, there were going to be those occasional difficult cases where somebody came in, and if there were some behavioral issues, a lot of times they ended up in the hospital, 911. So implementing a one-on-one for somebody when they first get here, first of all, gives the resident an extra sense of security and safety. They know they are not alone. I'm here with you, you are safe. Your wife, your husband, your daughter will be here later. They were here this morning, just kind of redirecting them in this strange new environment. And we find not only does it give the resident, a more comfortable feeling knowing that they're not alone, but it also is self-serving to a certain degree. We get to find out when we're in the bathroom with somebody or when we're trying to help them change out of a shirt that maybe they got a stain on at lunch. What is the true nitty-gritty of what we need to do for this person every day, and what approaches work, what approaches don't work, so that we can really tailor our approach to somebody and what they need. So the one-on-one for those first, few days has been so beneficial for so many residents and their families. That sense of guilt of moving somebody, it's really important to know that they're really not alone. They are with somebody.
Yeah, I think it's just such a wonderful part of the process because it is so scary to be in a new environment. And I think about, like, when I went to college, I wish I had a one-to-one come with me. I would have probably felt much more relaxed.
Your own tour guide, your own little, buddy to welcome you.
Everyone should have that.
Yes.
And speaking of buddies, I know you do something similar, family member to family member as well.
Yes, we do.
Yeah.
So a lot of times, families will ask if there's a family member they can speak to, a family, reference. And so we have a whole list of families here that, say that they're comfortable speaking to, an adult child, a spouse, whomever. And so we really try to match up that relationship as well. If I know that somebody who's been married for 50, 60 years is moving their spouse in, I'm going to pair them up with another spouse who's comfortable to talk about it, because that is going to be a much different experience than an adult child who may be making the move for their loved one. So we try to match them up with a family member who has had this experience and can really sort of welcome them, in an unofficial way to the bigger community of 80th Street.
Which I think is really beautiful because it's kind of coming from their lived perspective and their own experience, and there's no replacement for that.
Not at all. Nope.
Yeah. All right. So this brings me to my last question for right now. Sorry. In general, so we talked about all of the things that you're doing to support the transition. What can a family do to support their loved one in making the transition? I know a lot of families have questions about how frequently should I visit and when should, what should I do for my mom or dad to prepare them? What do you think makes for a really good transition?
Teamwork and collaboration, because, families will often ask, when do I visit? Should I not visit? Do you have a rule? We don't have a rule about visiting. The truth is each resident is going to respond differently. And we want families just to prepare and be able to be flexible, because we can do all this legwork, but we really don't know until somebody gets here what's going to be the right thing for the family to do. It may be that, yes, you need to be available to pop in every day for 15 minutes at a time. Or it may be, in this particular case, let's give it a couple of days and then come and visit. So I think the most important thing that a family can do is just understand that they need to be flexible and they need to trust us and understand that our ultimate goal is to make the resident feel as comfortable as possible. And in order to do that, we need to work with the family. Sometimes I think a big question from families is, well, what do I tell them? And we have always said to families, talk in terms of temporary. If you are going to tell them we're going to this place, a lot of times it's easier for them to understand we're going to try it. We're going to see how it goes, rather than something along the lines of we're moving to an assisted living facility, because that's a big pill to swallow. And a lot of times, the person may not remember the specifics of what was said, why they're coming to this community, but they're going to remember that feeling of anxiety. So in order to speak in terms of temporary, it's definitely going to go over a little bit better. Let us do the hard work. That's what we're here for. We're here to really explain things to the resident and tell them that they're safe, and, what works today may not work tomorrow. They may really respect their physician and that they need to have a little physical therapy here. And tomorrow they may think that their physician doesn't know what they're talking about. So that's going to be our responsibility to come up with something that is based in reality, but a kinder way to get them to feel better about being here. So I think for families, just try to remember that it's a collaboration and you've got to try and be flexible. And I think COVID has taught us all that. Try to be flexible, right?
We've all certainly, as flexible as we thought we were, we're all now even more flexible. It's been like yoga for the soul.
That's so true.
So, Lindsay, is there a common thing families omit that you wish they'd be more upfront about when moving a loved one in?
I have to say, honestly, I really don't think that happens very frequently here. I think that by having such open communication with the families before somebody moves in, I really do think that they feel a sense of comfort and that they can share with us the good, the bad, and the ugly. And I don't really think, there's nothing that pops in my mind that I can tell you that things have been omitted. Obviously, for us, it's really important we try to explain to the families if there are any behavioral symptoms of the disease, let us know so that when we see it here, we know that this is something that's been happening and it's not driven by the environmental change. So I think that that's probably just one of the most important things for families to know. You can share everything. Oversharing is better.
Thank you, Lindsay.
Yeah, that makes a lot of sense.
Yeah.
Has there been a situation where you've been working with a family and they've been absolutely dreading the move, dreading sharing the move with mom and dad, and then suddenly their loved one arrived and they were pleasantly surprised? Does that ever happen?
Absolutely. Yes. We used to try and plan move-ins around certain activities programs, sometimes for some residents. So if we knew that a person loved music, let's plan it around a small concert. If we knew that somebody loved art, let's plan it around our art discussion group. We would try to plan it around something so that a resident would get here and we would kind of take over. Get the resident, bring them to their activity, and let the family kind of easily say goodbye. And we would call them, and let them know how things are going. More often than not, residents will come in and get right involved in that activities program, which is great. Obviously now times are a little bit different with move-ins, but still, I think by having the level of support that we have and all of the activities that are taking place here and safely, socially distanced, again, it's getting the resident in, keeping them busy, keeping them engaged in things of interest, and a lot of families are pleasantly surprised. So, yes.
Yeah, and I have to say the recreation has not missed a beat. Everyone is still, full of joy, hopping around and enjoying themselves. And like you said, it's a bit more creative, but hasn't missed a beat. And it's still so much fun. So much fun.
Nope.
So, yeah. So we're coming to the end. I'm so sorry to keep you this long, but
it's been my pleasure. I love chatting with you ladies.
We just want to offer you the opportunity to share any final takeaways with the audience here with us today.
I would say, again, going back to my comment about being flexible, being able to adapt to the challenges that are coming, we are a community that is constantly evolving, and we are able to make changes. We're a mom and pop shop where we are able to quickly make changes if we need to. It's not this corporate ladder and corporate structure that we have to go up to get an okay from a regional head. So I think that that really helps a lot. And I think that, you know, families also have to a certain degree, be adaptable and evolving, because with this disease, we know that nobody's going to stay the same. Needs are going to change. And as they change, we're going to have to evolve our approaches and what we're doing. And, you know, I think the family just has to be willing also to be an active partner with us so that we can all continue to do what's best for their loved one. I think that's the most important thing to take away. And also reach out. Don't be scared to reach out to local organizations. Support groups are huge. I know a lot of them are going Zoom and virtual now, but talk to somebody. You know, this being a caregiver is one of the hardest jobs you can ever have. And all too often we see caregivers waiting too long before reaching out and getting help. And you have to take care of yourself if you're going to take care of somebody else as well.
Absolutely. Absolutely. And I know that you had mentioned you're more of like the mom and pop shop. So people do become really family. I know Kelly and I felt that with you as well, and with the residents and the families. And I know recently you all had a family council on Zoom. Did you want to share anything about that experience? Because I know when you shared it with us, it really brought us you know, a bit of happiness to hear.
So usually we do family council meetings in person. It's kind of like a town hall forum for the families to come in, hear about things happening at 80th Street. Obviously we can't do that right now. So we did a Zoom family council. And first of all, I can't believe how many people actually tuned in and came to the meeting. We had over 40 families that came in and participated in this meeting. It was really wonderful to see everybody. And one of the family members, you know, it was really such a touching sentiment that she had shared, that she was so looking forward to coming back to 80th Street and seeing her husband. But aside from seeing her husband, she was really looking forward to seeing the bigger community at 80th Street, the staff, the other residents, the other family members. And she had commented that 80th Street isn't just a residence for the residents who live here, but it really is a community for everybody. And I have to tell you that after everything we've been through over the last 6+ months, you know, to hear that, it really was a touching tribute to 80th Street and what our identity is, who we are as a community. So, yes.
Absolutely. Absolutely. And I think that's so important. Absolutely. And I was so glad that, you know, all the families were able to connect, because certainly, you know, when Kelly and I are there, we're able to see that it's not just the residents, it is the staff, it is the families, you know, and it is one community. Absolutely one community.
We're actually doing our first cocktails at twilight via Zoom this week or next week. I forget the actual date of it, but Cocktails at Twilight was always like an evening cocktail party that we'd have with the residents and the families. If residents were not feeling up to coming and joining, then the families can just come and have some hors d'oeuvres, listen to some music, and have some wine with us and get to know other families. So we all decided, let's do one via Zoom. So, you know, in the next week or two, we'll all be seeing each other again and enjoying in a nice glass of wine. So, yes.
Nettie and I will be there.
Yes, good.
We just invited ourselves on Caregiver Q&A.
Invitation is open to you ladies always.
Thank you. Even if it weren't, we'd still come and
I know.
your cocktail hour.
Lindsay, we cannot thank you enough for your time. It's always a pleasure to spend time with you and the community there. And we look forward to seeing you later in the week along with the residents. And again, it's always our pleasure to spend time with you in the community.
Thank you. It's my pleasure to chat with you ladies today, and hoping that I kind of shared some light a little bit about, you know, what moving really looks like, because I know it's so stressful for so many people, the residents, the families, and it doesn't have to be. If you work together, you can make things successful and go smoothly. So.
You did, and I think you also touched on some points that are going to transition really nicely into our next couple of slides. So thank you so much for that, and we're going to let you get back to work. Thank you so much, Lindsay.
Wonderful. Thank you, ladies.
Lindsay,
All right.
bye-bye.
Bye-bye.
As mentioned, introducing support or a move can be challenging, particularly if an individual living with dementia does not realize that he or she might need it. As much as it may seem counterintuitive, involving him or her in the process of deciding is important. There are some ways, simple ways, to give a sense of agency and control. The first thing to discuss with the individual and also to consider yourself is what matters most. There are traditionally 3 goals of care: comfort, compensation, and cure. Think about your personal goals for introducing support. Is it for your comfort? For your care partner's comfort? Are you hoping to empower him or her by introducing stimulation or structure in or outside of the home? It's important that you are clear before speaking with your family member or friend. Then consider what matters most to him or her. If it's remaining independent, is there an opportunity for the home attendant to partner with him or her on exercises to support balance and cognition? If he or she does not recognize the need for support, is there a role in the community or a project that perhaps he or she and the support team can become involved with together? Asking what matters most to the person and creating opportunity this way sets up a more successful transition. Kelly, would you like to hit the rest of the points on this slide?
Sure, absolutely. And I think that you really kind of nailed down one of the most important factors. But we'll talk a little bit about how to implement the change once that's identified. So one of the first tips, and you see it up on the slide, is to incorporate controlled choice. Individuals who are living with cognitive change, and all individuals in general, tend to respond better to support if they have the opportunity to make decisions about how it's offered, when it's offered, and from whom they're receiving their assistance, right? Everybody kind of wants to have a say over those pieces. Obviously, when there is cognitive change involved, and depending on the resources that you have, there are limits to how much choice you can offer. But as a rule, whenever it is possible, you should try to offer a controlled choice. So a choice out of 2. You know you're offering a controlled choice when you ask the question, would you rather A or B? And so that might be, would you rather partner with Alicia or Cameron? Would you rather she join you at lunchtime or at dinner time? Would you rather stay at the big community or at the smaller one? Should we take this comforter with us or that one? Do you want this portrait hung in your room or that portrait? So on and so forth. So you're giving as much control as possible over small details. Now, it's certainly important as you're introducing those points and those choices not to barrage your loved one or the individual that you're partnering with, because that'll be overwhelming. But gradually incorporating these decisions is a great way to give that sense of agency that we talked about. Another way of honoring choice is to ask the person that you're partnering with to try out an option for some time. This can be a gentler way of introducing change gradually rather than causing an individual to feel trapped and have that sense of permanence. And so one of the ways that I know, Nettie, you and I have both had some success with transitions is to say, would you be willing to try this out for a week? Would you be willing to try this out for a couple of weeks? And maybe we don't put an exact time. There are some people who really, really need that exact length of time and then to truly reevaluate at the end of the week. And then there are other people who may be okay with a little bit more of a fluid constraint. And as they become more comfortable in the decision, the transition happens in and of itself without that push from external pressure. Okay, so that's kind of offering a different type of choice and honoring a different type of choice. Now, you may say my loved one can't decide, or my friend will become confused by too many choices. There are some ways to introduce choice that can provide clarity and overcome memory deficits. And so one of the ways that we've had a lot of success doing that is to use a visual cue or a picture to support memory of who the person is that I met, or where the place is that I toured, or the video that I saw of the place. And so that can kind of capture some of the information for the person. Another thing that we'll often do to accompany that visual picture or that video is capture a few notes immediately after the visit or the exposure to the place or the video with the response of the individual. That way he or she can refer back in his or her own words when it comes time to make a decision. And so I'll just use a very quick example, a quick scenario. We were partnering with a woman who had been living independently for several decades. She had lost her husband young, and she was fiercely independent because she'd been widowed for a long time and living on her own. When it came time to introduce some support, she genuinely felt that it would change the dynamic in her household. She was not willing to admit that she needed the support. She didn't feel she needed it because she was physically still very spry and able to do things for herself. And so companion after companion and aide after aide went to the apartment and got invited to leave, sometimes not so gently. When we stepped back with the companion agency and the family and said, do you think we could just offer a choice of 2 companions and your mom can interview the 2 companions? That was the key that really got the person in the door, and she felt that she had been asked and that her kids were hearing her and honoring her desire to be independent. And so sometimes it's just changing that one thing that can really open up opportunity. Visual cues can also be used as a reminder when a loved one ultimately decides on the person. So if you have a loved one who maybe isn't recognizing or recalling who the person is that's visiting, you may want to actually use that same image in a binder with a couple of lines about that person. And mom, your appointment is on Monday, Wednesday, and Friday from X time to Y time with so-and-so. Okay, so that's how to incorporate visual cues. And then, as mentioned, another area to, yep.
If I can just intervene, I just wanted to share a client that I worked with on the visual cues.
Sure.
Do you mind? I'm sorry to interrupt, but I think this might be helpful to some families.
That's what it's all about.
Yes. There was a rehab agency that had brought me in for a consultation. And basically, when I started speaking to the family care partner, you know, she had just become so overwhelmed, and therapy, physical therapy was working. However, what was happening is they had these steps that they lived in a brownstone, and they had steps that they had to continuously work with him on getting up. And the more we started talking, she realized that assisted living was around the corner. And so we had worked together to get home care in, and then she was planning her plan C, actually. And she was worried about how he would react. And so we talked around how the conversation might go, and then we set up 3 different assisted livings because she had gone and she narrowed it down to 3. And then we set up appointments at all 3. And basically, not all 3 in one day. We had them spaced apart because that would be very overwhelming for anybody. But what we did is we actually brought our phones and we took pictures at each of the assisted living for each time he responded to something on a positive. And then, as Kelly said, we got his reaction to it. And then when we went back to the home, what we were able to do is we just got one of those plain white poster boards. We printed out the pictures. We wrote his statements on there. And then once a day, they would meet with him and kind of talk it over on, again, why they thought that assisted living might be supportive for him. And the therapist was involved in the conversation as well. And then they looked at, well, this is what you said about this one. This is what you said about this one. And eventually he came to make his own decision about the assisted living by using the visual cues and also echoing back his statements, because he was able to read what he said at the visits. So again, that was really about like involving him, you know, recognizing what mattered most to him and creating the partnership and that husband-wife thing, because it had always been that they made decisions together, and that's why she was having so much guilt. She couldn't bring herself to make the decision without him. So we had to figure out a way, how do they partner and continue making decisions together? So they actually live in an assisted living right now here in Manhattan, and they're quite successful. So I just wanted to share that. I thought it was a beautiful way to really bring, you know, the marriage still continuing to make decisions together. And he lives with cognitive change, and it was possible.
Yeah, I think that's fantastic. And the way that it plays into the relationship dynamic is really important as well.
Yeah.
So Nettie, I actually think that anecdote kind of speaks nicely to this final point about timing. So you mentioned the example of the two care partners who were able to make a decision, and even though the husband was a little bit progressed in his cognitive change, they were able to use these supports to prepare him for the move, and he was able to be part of that decision-making process far in advance of the move. I think sometimes when we prepare for these types of situations early on in the cognitive change, it's easier to involve a loved one for the eventual move when it's down the road, or for what he or she is looking for in a partner down the road. But when a move is imminent, and the person might be a little more progressed in the disease, or they may experience a little bit more anxiety, it is possible to give too much information too soon. So it's best to give a minimum, I would say, and correct me if you agree or disagree. I would say a minimum of 2 to 3 days when somebody is a little bit more advanced into the disease progression and might struggle with anxiety, so that they have time to kind of get the idea, get used to the idea, not feel completely blindsided by the move, but also not have a long length of time to kind of perseverate and worry and experience nerves. Would you agree with that more or less from your experience?
Yes, I think so. And then also, I think from the care partner's perspective, they're going to know as well, because we always do believe that the care partner knows best. You're going to know kind of what the right timing is too.
The other thing is, if you know to kind of anticipate a spike in anxiety, or you're anticipating that maybe there's going to be a bit of pushback, waiting to time it so that there is the opportunity for additional check-ins or for one-to-one emotional support kind of leading up to the time of the move, I think is really crucial. So you need to look at, with timing, what works for your loved one, what works best for you, and really kind of trying to maximize the impact of when you choose to kind of share the information.
Sure.
All right. So on this slide, and I know Lindsay touched on this kind of during her interview with us, we really need healthy care partners. And in order to have healthy care partners, there are a couple of things out there that we really do want you to have as resources. And certainly Nettie and I are happy to connect people with other resources. As Lindsay mentioned, that's part of the Training, Education, and Resource Center that we run. So support groups, I know that they get touched upon very frequently. Nettie and I have certainly heard from people who feel, I tried a support group, it's just not for me. Everybody in that group had folks that were more progressed, or they weren't in the same situation. I'm a spouse and it was all adult children. We want you to know there are virtual telephonic support groups out there for care partners. They might be for spousal care partners. They might be for adult children. They might be for younger children. Some of them are for individuals who are living with cognitive change. I know Dementia Action Alliance is a phenomenal resource for people who are living with young onset illnesses that cause cognitive change. And then also, there are many different specialized support groups for people that have a differential diagnosis. So somebody who's living with Alzheimer's disease or whose parent or spouse is living with Alzheimer's disease is going to experience a very different set of symptoms and a different lifestyle change than someone whose spouse or loved one might be living with Parkinsonian dementia or dementia with Lewy bodies or frontotemporal dementia. And so it's also important to know that there are so many different associations out there and organizations out there who serve these different populations. And many of them also host support groups. If you're looking for something that's really tailored to your specific needs and maybe you're not quite sure what the options are out there, please don't hesitate. That's what Nettie and I are here for. It's one of the things that we really enjoy doing is connecting people. So if you would like that kind of information, email us. We can be reached at info@inspiredmemorycare.com. Again, it's info@inspiredmemorycare.com. And we'll work to connect you with some of our friends or contacts in the industry who might be able to best support you. The other piece of this, support groups are phenomenal and they're great for, I have one client who says, you know, finding your tribe, other people that are living a similar experience to you. But on the other side of that is just plain fun and leisure outside maybe of talking about the disease or talking about the experience that you're having. And so there are tons and tons of programs now where there are dementia-friendly communities. I think of all of the different museum programs that are now out there through the accessibility branches for individuals who are living with cognitive change. There are musical experiences that are out there. There are dance experiences for people that are out there. Some of them are shared. There was one recently that was specifically for dance for care partners so that you can kind of connect through movement with one another. And I think that's phenomenal. There are also experiences that are just for the family carer or the professional carer, or just for the individual living with cognitive change. And so I think it's nice to have the option to nurture your own personal identity, as we all kind of need to do, and nurture that need for socialization, but then also have the ability to nurture your relationship together as a parent and child, or as a spouse, or as siblings. And so again, if you'd like some further resources about that, please, please, please don't hesitate to reach out to us. Nettie mentioned earlier that we've done a lot of other Q&A sessions and episodes where we do highlight resources that are out in the community. So those are at your fingertips. But if you don't have time to weed through the information and you really want something just kind of quick, go ahead and reach out. Feel free by email or in the comments section.
So that brings us to the conclusion today, and we'd really like to thank you for joining us. And also, as Kelly said, if you would like to ask us any questions about resources, do please email us, and I did put the email in the comments section. You can also join our mailing list if you want to just go to our website, and it's listed here at www.inspiredmemorycare.com. There is a place where you can subscribe to our mailing list, and then you'll occasionally receive some of our invitations to our education sessions, and you can certainly join those, and most of them are complimentary. And if there's a fee, then you don't join that one, no problem. You can also learn more about our subscription activity program. If you're looking for more ways to engage your loved one, please feel free to learn more about that. And we also would like to give a shout out to the 80th Street residents for allowing us to host our Education and Resource Center there. So we're able to pilot many of our programs, our education programs, our activity programs. So we certainly appreciate them. And we appreciate that Lindsay was able to join us today to share a little bit about an experience touring at an assisted living with memory care. And so we do hope that you were able to take away some tips. Now, just a little bit of change in schedule for next Monday. We will not actually be here next Monday live. We will be back on Monday, October 19th for our next episode. So we do hope that you tune in and join us live for Are you exhausted and unable to rest? Dementia and sleep disruption. Again, we will be back on Monday, October 19th for our next episode on Care Partner Q&A Mondays. And the title is, Are You Exhausted and Unable to Rest? Dementia and Sleep Disruption. So I hope you can join us. And until then, stay inspired.
Thank you. And special thanks to Lindsay Harbison of the 80th Street residents for joining us today. Have a great day, everybody.